Hey, CE Impact subscribers. Welcome to the Game Changers Clinical Conversations podcast. I'm your host, Josh Kinsey, and as always, I'm super excited about our conversation today. Dry eye syndrome is more than just an annoyance. It can significantly impact vision, comfort, and overall quality of life. In this episode, we'll explore the causes, latest treatment options, and how pharmacists can play a key role in helping patients find lasting relief from dry eye syndrome. It's so great to have our guest expert with us today, Jennifer Salvon. Thank you so much for joining us, Jen.
Thank you. I'm excited to be here.
Yeah, we appreciate you taking time out of your schedule to join us. So for our listeners out there, if you can just give us a little bit of brief introduction to yourself, tell us a little bit about your background and your practice setting and maybe your passion for today's topic.
Great. Thank you. I'm a clinical pharmacist at a small hospital in Western Massachusetts. I've worn a lot of hats over the years, including over 15 years as a community pharmacist. A lot of times I'd have patients come in struggling with their dry eye disease and ask me what to take and what to do. And I've always found the dozens of products out there a little daunting. Hopefully our discussion today will provide some insight on dry eye disease and the treatments and the artificial tear products that are out there.
Yeah, that's great. Yeah, I can agree. It's been a while since I've practiced in pharmacy officially. But yeah, having owned my own store and, spent a lot of my career in community practice, and ever since I was 16 years old, been working in a community pharmacy. I feel like that this is one of the most daunting aisles in the pharmacy OTC section is the eye area, because there's so many products and they all seem like they're the same and everybody makes a version of something. And yeah, I completely agree. So I've been really, really excited about this conversation today because I think it's something that all pharmacists struggle with, in my opinion. And so we're going to give them some great tips to take back. So this is great. Okay, so again, thank you for joining us. I really appreciate it. Let's jump into our first kind of topic. So I always like to lay the foundation. So let's just review exactly what is dry eye syndrome. So, maybe let's talk about the prevalence, what are some of the causes, and just also how does it impact patients' daily life?
Excellent. I sometimes like to start with the anatomy involved because that helps us understand why it happens. So on your eye, there's a tear film, and it's a coating that keeps the eyes moist. And when it becomes unbalanced, the tear film breaks down, leading to inflammation and damage to the eye surface. So it's important for that to stay in homeostasis. There's actually 3 layers to the tear film. There's the outer layer, which is a lipid layer, and the meibomian glands take care of this layer. Now, the meibomian glands, you may not know, they're on the inside of the eyelid, and they produce lipids to keep your eye moist.
Okay.
There's a middle layer that's basically water, and the lacrimal glands produce those, and those are located on the outer edges of your eye socket. And then there's an inner layer that are produced, it's called the mucin layer, and it's produced by goblet cells, and that's in your conjunctiva. So altogether, that kind of lubricates and keeps your eye safe from everything in our environment. Our eyes are open, and there's, just dirt and everything, blowing in your face and getting in there. So this tear film is essential for your eye health.
So it's almost like even like a 3-part checks and balances system. Like if a piece of debris gets through one, maybe the other is going to catch it and sweep it out and whatever. So yeah. Okay.
So
that's a great foundation.
Yeah. Okay. Hopefully,
I don't necessarily remember that there's 3 parts of that. So this is great. Yeah. Keep going. Tell me more.
Well, and I think I like to know about stuff like that because that helps us guide us on what could be used to treat something. Where is it breaking down? Meibomian gland disease is something that people have. So if you know it's that, then you may approach the treatment in one way versus another.
That makes sense. Okay.
Yeah. There's a lot of different risk factors to developing dry eyes. People divide them into modifiable and non-modifiable. The thing you can't modify is age. As we get older, our eyes get drier. So there's something we have to deal with. Usually there's a higher prevalence in people over 50, but what we've been finding is the age group of 18 to 49, the incidence is rising. And can you guess why?
I would assume environmental factors and also staring at screens.
Staring at screens. That's
Hmm.
exactly it. One
Hmm.
of the things that they're finding is causing it is everyone's got a screen in front of them, and we're just on them
Hmm.
all day long. Like we're on a screen here, you're on a screen and you're writing, you're on a screen and you're filling prescriptions. I mean, it's hard to get away from being on a screen. So that's one of the
Yeah.
biggest risk factors or biggest things that cause dry eye disease. So knowing
Mm.
about that, and I can give you some ideas about, how to mitigate that, as we talk.
Mm.
So
Yeah, that's
be
great.
good. The other thing is it's more common in females versus males.
Hmm.
Um, so it primarily because there's hormonal changes in women that
Okay.
precipitate dry eye disease. Also, cosmetic use. Women put on makeup, and so that
Mm.
having that on their eyes and getting in their eyes can damage the tear film. So that's another
Gotcha.
avenue.
That
Yeah.
makes sense. Okay.
Another well, those are non-modifiable. The computer screen is modifiable, but the other thing is wearing contact lenses
Hmm.
that can precipitate dry eye disease. So a lot of people I find are switching to glasses versus wearing their
Hmm.
contacts all the time, especially if they have dry eye disease. The
Hmm.
environment, being in an air conditioned environment, being out in the wind, the sun, at the beach with the sand blowing. Caffeine consumption, unfortunately, precipitates dry eye disease or can
Wow.
contribute to it. Yeah. And then a lot of meds, which we can talk about later, but there are medications that predispose you to having dry eyes. So,
Okay. Yeah, that's great. You lost me at sand. One of my biggest fears in the world is sand. I hate sand. I can't. It feels like it gets everywhere, and you can never get rid of it. So yeah, the whole idea of like sand blowing in my eyes, I just went down this whole like rabbit hole of just freaking out. So
you could, the
yeah.
first time I go to the beach each summer, I'm like, I can't. It takes me like a half an hour to get used to having
Uh,
sand on everything.
That's the worst, the absolute worst. I mean, I love the beach, but man, I wish it didn't have so much sand. So yeah, okay, so that's great. Let's if you can also let us know, like, are we talking? What's the prevalence, kind of, for our patients in dry eye syndrome?
Well, it's actually pretty prevalent, and it's hard to tell the exact prevalence. Estimates say over 16 million people, adult people in the US, have dry eye
Wow.
disease, but some feel this is on the low side because dry eye disease can be underreported and undertreated because people just go
Mm.
out and buy dry eye drops and no one
Hmm.
even knows that they have it.
Hmm. Or
So,
they just push through, like they're just like,
right,
oh, and let me blink some more, or let me take my contacts out. My eyes are really dry today, or
right,
something.
right. So
Yeah.
I do believe it's underdiagnosed and undertreated. So
Mm.
that's one thing. The other thing is economically, it has a direct cost over $3.5 billion a year in direct medical costs, which I thought was an
Wow.
interesting number. That's huge. And then
Yeah.
indirect medical costs, which is lost productivity, which is huge for this as well. If you can't
Hmm.
see as well, you're not going into work. If you
Hmm.
have to go to doctor's offices or you're out picking up medications, you're not as productive. And
Sure.
that doesn't even get into the quality of life impact.
Right.
So, say you are having trouble with your eyes, you can't read, you can't drive, you can't watch
Mhm.
TV, and you can't be on your phone.
Yeah.
It's got far-reaching repercussions.
It's a lot. Yeah. And I mean, even thinking about too how that could translate down into being, a barrier or a challenge for your patients to get medication. Because, like, what if, like you said, what if they can't drive anymore? And so they don't have a way to get to the pharmacy, and they don't have a way to get to their doctor. And, you know, then they don't have a way to get their meds or stay adherent and whatever. So just a lot of different things that could be kind of compounded with just the fact of, dry gets out of hand or whatever. So yeah. Yeah.
Right. Yeah.
Um, so what are some of the common symptoms that we're going to see of someone? So what are we looking for to say, maybe this is dry? Maybe this is more severe than just, I got something in my eye and I've rubbed it and now it hurts a little bit. Like,
Right. Right. I
what
mean,
would
that's
be a dry syndrome?
kind of the way it starts. You have a burning sensation under your eyelids. It's uncomfortable. Sometimes it feels like there's dirt or sand
Hmm.
underneath
Hmm.
your underneath your eye.
Great.
They
Biggest
can,
fear.
yeah, they can be itchy and red. You can start having visual changes. You may think you need glasses, or it could feel like your allergies are coming on. And
Hmm.
and that's a hard thing because to differentiate dry eye disease from other things like allergies can be difficult.
Hmm. Yeah. So when we're talking with patients and we're seeing them maybe looking at things in the aisle or whatever, if they're maybe trying to self-medicate or whatnot, what are some of the I guess what are some of the things we would ask for to be able to confirm like maybe this is dry eye syndrome, like that would guide us into the direction of which medication to choose, I guess.
Well, I think that can be hard, but you could ask them questions about, is it allergy season? Do you get allergies all the
Mhm.
time? Does this continue throughout the year? Do you find that it's worse when you go into work or when you go
Mm,
into a movie theater or when you go into a cold environment? You can try to ask questions about what's triggering it. Do they notice what's
mm,
triggering it?
yeah,
Are there
yeah,
any foods or anything? There's a lot to go into it. You can also
yeah.
ask them if they have any underlying conditions, because a lot of times autoimmune conditions will cause dry eye.
Okay.
So that's one of the things, as you're asking questions, you could find out that they have other symptoms. And one of the times you might refer them to an eye care specialist or their PCP just to have
Hmm.
some tests run to make sure there isn't more going on there.
Right, right, exactly. Yeah. Um, you mentioned autoimmune disease. Is it all autoimmune diseases, or are there specific ones that we should be looking out for that put our
There's
patients at greater risk?
Yeah, not all of them, but there's a couple that come to mind.
Okay.
Not sure I'm going to say it right. Sjorgen syndrome.
Okay. Okay.
Yep, that's a big one that'll do it. And rheumatoid arthritis is another one. But Sjorgen's
Okay.
syndrome affects the salivary and lacrimal glands. So you're going to have dry mouth, but you'll also have dry eyes. So
Mm,
that's one that comes to mind. I think dry eyes go with Sjorgen's syndrome, but you can have dry eye disease without having that, and vice versa.
sure. Of
Yeah.
course. Of course. Yeah. Okay. But just knowing that some autoimmune diseases may may
Yes.
cause dry
Yes,
eye
you
or
could have someone
may
who's
make it
picking up
worse.
the rheumatoid arthritis med and mention that their eyes are killing them, and you
Hmm.
could,
Hmm.
they're itching them all the time, they're rubbing
Yep.
them, what can they
That
do?
could lead to further conversation. Yeah. Okay.
Right.
Great. So, touching on the fact of obviously we're pharmacists and we want to know how we can help. So, what's your take on the role of pharmacist in helping to manage and treat dry eye disease?
Well, I think pharmacists can be key. I mean, we're one of the most accessible healthcare providers. We're right out
Hmm.
there. Whether we actually have the time is debatable to
Sure.
spend time talking to a patient, but I think if we can, it's important to. I think we have a huge role in patient education, and patient
Hmm.
education is a big part of treating dry eye disease. There's a lot of environmental factors, lifestyle modifications. The first steps of treating dry eye disease involve patient education, over the counter
Hmm.
artificial teardrops, and lid hygiene, which we can talk about a little more. That's one of the things that
Oh,
can help with
yeah.
dry eye disease. Yeah.
That's interesting. I don't think I've ever heard that phrase, lid hygiene. Okay, that's
Lid
good.
hygiene is interesting.
So yeah, so that's actually a perfect segue. So that's what I wanted to go into next, was kind of focusing more on the opportunities that we have as a pharmacist. So you mentioned educating patients on lifestyle modifications and preventative measures. So what are some of those things that we can talk about with our patients?
Well, I mean, we mentioned before how the environment can cause dry eye
Sure.
disease. So
Hmm.
something as simple as wearing sunglasses can help a
Mm,
lot. And I think some
hmm.
people just don't wear them. If you
Hmm.
have a heavier brow, the sun might not affect your eyes. I don't need heavy sunglasses. The sunglasses I use are kind of light, but I've started wearing darker ones and making sure they're big enough to cover your eyes, and that'll help
Hmm.
protect them.
Hmm.
In your house, you could use an air humidifier.
Mm.
Especially this time of year, the air in our house, with the heat running, depending on where you are, the heat running,
So dry.
it's
Hmm.
very dry. And so I
Hmm.
notice my eyes are more watery in the winter, and I try to have an air humidifier going.
Hmm.
Conversely, if you have air conditioning running, I think people that live down south have it harder because you can't go outside as much because it's so hot. So minimizing your exposure to air conditioning. People
Okay.
who smoke, if you're a smoker,
Uh,
the smoke
sure.
can, dry out your eyes and irritate them. So that's something. In terms of lifestyle modification, dehydration is huge, or hydration, proper
Mm.
hydration.
Mhm.
So people who are dehydrated, and I run into people all the time that say, "Oh God, I haven't had anything to drink all day." And I'm like,
Mm,
oh yeah, in general, I mean, with so many things in our life, but especially if you have any
sure.
kind of dryness, dry eye disease, they
Hmm.
say that you're supposed to drink as many ounces of water as you weigh in kilograms. So say
Wow.
you weigh 75 kilos, which isn't that a lot, that's what is that,
Right.
150 pounds, that's 75 ounces of water. And that's hard. I think it's hard
That's a
sometimes
lot.
for some people. Yeah,
Yeah,
it's
that's
a
a
lot.
lot. And it's interesting too to think, I mean, it makes sense. It's not like it's, well, that's odd, but the fact that hydrating your body makes your eyes less dry. I mean, like the fact that that translates into, making sure that your eyes are hydrated too. So you just don't think about that being where that water goes, I guess. So,
Right.
so
Well,
that makes sense. Yeah.
yeah, you think about it, because that film I talked about, a lot of it is aqueous. And so if that is
Right.
down, it increases the osmolarity of it. So there are things in there and they just get more concentrated, and that's not as good for your eye.
Yeah, it makes sense now that you gave us that great introduction and the reminder of the structure of the eye. That was so good. Um, so yeah, so what about let's jump in because I want us to be sure that we spend time on this because we talked about this being one of the most daunting parts of
Can
it.
I say one more thing? I'm sorry.
Yes, please do.
One
Yes,
more
please
thing,
do.
dietary supplementation.
Oh yes, please.
I have a
Yes.
passion for dietary supplements. So I've done a lot of studying on it. But one of the things in dry eye disease you can do, and this helps you in a lot of ways, is supplement with omega-3 fatty acids. And
Okay.
there are studies out there right now. The studies are inconclusive, but some have really shown promise. And when you think about how omega-3 fatty acids block pro-inflammatory substances in the body, that can help with the inflammation cycle of the eye. So that's one of the things they're studying. And another avenue they're studying is topical omega-3 supplementation, that
Oh,
or
interesting.
application. It hasn't gotten there yet, but that's something that's out there.
Interesting.
Yeah,
That is definitely something I've never heard before. That's great.
that was
Okay.
one that jumped out at
Yeah,
me.
no, I'm glad you added that. That's super interesting. Yeah, that's great.
All right, cool.
So one of the things I want to be sure we jump into is the over the counter treatment options. So I know that that can be very daunting. So let's kind of talk about. I'd love for you to share some maybe tips and tricks of like again that aisle is so there's overwhelming. So many products. They all kind of seem the same. Everybody makes a version of everything. So
Me
how can
too.
we
Oh my
approach
gosh.
that? Yeah, how can we approach that as the pharmacist and make it manageable so that we can actually relay that information accurately to our patients?
It's funny because I always thought this when I went down the cough and cold aisle. When you finally look at the packages, there's like a dozen ingredients and that's it. But there's hundreds of products out there, and it's similar
True.
for artificial tears. So
Yep.
artificial tears, I'll spend time talking about because that's really the OTC product that patients need help with.
Okay.
And in artificial tears, there's maybe 6 different categories of ingredients, but the biggest one is a demulcent. And that's something that increases the viscosity of the drop to increase the time that it stays on your eye and helps add that lubrication. And that
Okay.
can be kind of a tricky thing to balance because if it's got too much in it, it's going to be more of a gel and you're not going to see anything. You're going to be
Oh, it's
blinking,
going
it's
to
going to be blurry.
glaze you over.
Yeah.
Yeah. Yeah.
And then there could be ones that just don't help at all. So a lot of products, I just want to see, thicker's not always better. I wanted to give some examples of demulcents. Hyaluronic acid, propylene glycol, and carboxymethylcellulose. Those are 3 of the most popular. Another ingredient are oils. We talked about there was an oily layer to the tear film. And so
Hmm.
adding an oil like mineral oil or flaxseed oil, that can help restore the lipid layer if that's an issue. And it can help prevent tear evaporation. One thing I do want to mention that's in them is preservatives. Now,
Mm.
the most common preservative is benzalkonium chloride. And the conundrum here is you need them in multi-dose bottles to decrease contamination
Contamination.
and
Hmm.
yes, but they actually contribute to corneal damage and can precipitate,
Lovely.
dry eye disease and disrupt the tear film. So one thing that's new that I want to mention is these disappearing preservatives, and that's sodium chloride and sodium perboate. These don't have the same effect on the tear film. So there's a lot of interest in products that contain these preservatives instead. That
Okay.
said, preservative free is the best thing to do. So
Sure. Sure. But again, remembering that preservative free usually means that it's going to be like a one-time use kind of thing, which is
Yes,
probably going to make it more expensive because it's not
much
a
more
multi-dose
expensive.
vial. Yeah.
Right.
So, yeah. So again, just remembering and weighing those options. But I think it's important to understand the impact of the preservatives. And,
Right.
if you're explaining that correctly to the patients, maybe they're willing to pay a little bit more so that they're not adding something more
Absolutely.
dangerous to their eyes.
Yeah.
So, yeah.
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 Another thing is wherever you practice and depending on your location, keeping your eye out for sales. If there's a
Hmm.
preservative free and you have patients that are struggling with dry eye disease, and letting them know that can be something that'll be helpful for them.
Yeah, that's great. That's great. So basically, what you're suggesting, advocating for, is to fully understand the active ingredients
Yep.
and and make your choices based on that, as opposed to just like, I have a favorite product, it's in the red box or whatever. So it's more about like also understanding too, as you mentioned, some of those things treat the different aspects of it. So is it a lipid issue, or is it a whatever.
Right.
So understanding which ones to add, that's super helpful. Yeah.
I think it would be important for pharmacists to look at the products available at their location and pick 3 or 4 that they know
Mm,
have the carboxymethylcellulose or hyaluronic acid or propylene glycol and one of those newer disappearing preservatives or preservative free, and just have those as their go-tos.
mm-hmm,
Then
mm-hmm.
they're not out
Yeah,
there wondering. You know what I mean? It takes a little bit of homework, but in the long
sure.
run, if you've got those 3 or 4 products, then you'll feel
It's
like
going
you've
to
got
benefit.
something in your armamentarium that you can actually do and not take as much time, you
Well,
know?
and let's be honest. I mean, if you go out there with a plan, your patient is probably going to trust you more because you're going to know exactly what you're talking about, as opposed to being like, oh, I don't know. Let's see. Let's turn this around and see what's in this one, and let's touch this one,
Right,
and
that's
you
never a good
know,
look. Hang on,
yeah, it
let's
doesn't.
see what's in
Yeah.
this one.
Let
Yeah,
me just double check and then I can talk to you about it. I think
right,
so. I
right.
think you're right. I think it would make our conversation more impactful with the patient. I think it would really drive home the point that we know what we're talking about.
Yeah,
So, yeah. So like you said, do a little work on the front end, a little bit of homework, and be prepared and research, and that way you're better able to answer the patient's questions and to recommend a product
yeah,
easily.
yeah. Another thing
That's
to
great.
keep in mind is when you have that product and you're recommending it, consistency and patience is key.
Mm,
Patients are going to use this and think like tomorrow their eyes are going to feel better, and really that's not an expectation. It's good to what do I want to say, get rid of that expectation, or make the
mm-hmm.
expectation clear.
Eliminate it.
And I
Yeah,
have to
yeah.
use this for 3 or 4 times a day for almost a month to see if it's going to work or not. And
Mm,
unfortunately, the first product you pick might not be the right one. Say you start with a hyaluronic acid one and it's got a preservative in it and it's not working. Maybe you progress to a product that has two. There are combination products that might have the
sure.
CNC, the carboxymethylcellulose, and the hyaluronic acid. That might work. So unfortunately, there is a little bit of trial and error with it, but
Mhm.
having a having a direction to point the patient in can be a lot better. Because one of the biggest problems from I would hear from patients and what they have is trying 100 different products, spending all this money,
Mm,
having all these
mhm,
bottles on their shelves, and nothing's
mhm.
working.
Yeah. Well, and I think it's good to point out that, it's not I do not like putting drops in my eyes, so I would be that person that's like, "Oh, yeah, I did it once and I hated it." So I feel like it's really important to set the stage and to say, it's going to have to be X number of times a day. It's going to have to be for a month. You're going to have to make sure, whatever. But like you mentioned too, patients are all different. So it makes sense that some of the products are not going to work for some patients because
Right.
some of them may need the lipid replenishment and some of them may not, and some of them may not need, the one that glazes over the carboxymethylcellulose and whatever. So yeah, it's going to unfortunately be a little bit of trial and error for patients. I think that expectation is important to set up as well.
Yes, and they may need the ones that I said that coat your eye more. That's something you could actually recommend for someone at nighttime. So put it on,
Mm.
close your eyes, go to bed. Then by the morning, you can kind of rinse your eyes off, and hopefully you've got retained the moisture from sleeping with the gel on your eyes.
Oh yeah, that's a great idea. That's great. So one thing too to touch on really quick, unless you had more about OTCs, did you have anything else
I
you wanted to share on
think
that?
I'm good. I used to gel at
Okay.
night was one. Yeah. Okay.
Okay, perfect.
Cool.
So one thing, just really quick, while we're talking about treatments, there are some prescription treatments. I don't want to spend a ton of time on them because I felt like the majority of our time needed to be on the OTCs. But just so that we're aware, what are some of those prescription meds that would treat dry eye?
There's several eye drops out there that I'm sure people are used to filling. Cyclosporin eye drops have been around for a
Hmm.
couple of decades. The
Hmm.
hard part is cyclosporin is not easy to get into solution.
Mm,
So, and it causes a lot of the same symptoms you're trying to get rid of. So it causes
mm,
burning in your eyes, redness. Um, about 50% of patients don't continue with it because of that.
mm.
If you can
Okay.
persevere, the side effects do get a little better and people find improvement. They are working on new formulations, a nano emulsion, so that kind of increases the time and decreases the side effects. So
Okay.
that'll be coming. Lifitegrast is another one that's been around for a few years. It's another, all these products affect the inflammatory cycle kind of from different avenues. So
Okay.
lifitegrast, so if something doesn't work for a patient, they could try another one. So if cyclosporin A
Okay.
isn't working, they've progressed past artificial tears. Cyclosporin A didn't work. Lifitegrast could be an option too, because it has a slightly different mechanism of action. And it actually has fewer side effects than cyclosporin.
Okay.
A newer one is, and hopefully I say this right, perfluorohexyloctane.
Okay.
This was approved about 2 years ago, and it decreases tear evaporation from the ocular surface. They don't know exactly how, but it has great success with some patients with dry eye disease. That's another eye drop.
Okay.
Yeah,
Yeah. And so I think it's really also, I'm going to reiterate what you stated. It's really important to note that if patients do try the OTC formulas and, they don't get relief, that there are prescription options to try. And there are also a couple of different ones. Like, it's not like oh, well, you've tried this one, so you're out of
right,
luck. There's nothing else. So
right,
it's important to note that there are some steps and there are some ways to kind of get relief, even if they don't see it with a certain product.
right.
Um, so one of the things we talked a little bit about some of the challenges, so differentiating it from other ocular conditions. So you mentioned how it kind of mimics allergies as well. So if you want to talk a little bit more about how, making sure that you're framing the questions correctly, because it could be that, a patient, if you're using something to treat allergies, it could be causing dry eyes, right? So
Right,
if you
right.
want to talk
That's
a
a
little
good
bit about
segue
that.
into actually, I did want to mention medications.
Yes.
Here we are,
Oh, yes.
we fill prescriptions all day, every day.
Hmm.
And there are a lot of medications that can contribute to dry
That
eye
can cause
disease.
it.
So if you
Hmm.
have someone that's complaining about it, it could be something they're taking, like allergy medications. There's also, but some antidepressants will cause it. The
Okay.
tricyclics and the SSRIs will can cause dry eye disease.
Hmm.
Beta blockers cause dry
Mm.
eye disease as a side effect. Diuretics, of course, that brings back the whole hydration, and a diuretic is
Sure.
decreasing your water load. So
Yep.
proton pump inhibitors. A lot of people out there are on, omeprazole or pantoprazole and have
Hmm.
problems with reflux. And then another thing that kind of touches upon the female side of it is hormone therapy.
Oh, sure.
So, when women are taking estrogen, that can affect your eyes and the lubrication in your eyes.
Okay. Yeah. No, that's great information. The TCAs make sense as well because they're,
Yep.
what they do in general, and they dry up everything in general. So that makes sense. So yeah, it's great to kind of point those out because they may not necessarily be something that's just on the forefront of your mind. Is a prescription medication may actually be causing it. So yeah,
Right. Right.
that's great. So then touching on a little bit too with the fact that, as you mentioned, treating allergies with antihistamines can also precipitate dry eye disease as well, right? So,
Because
yeah.
hay fever causes runny eyes.
Hmm.
And you want to,
Yep.
it's like a double-edged sword. You got to decide which,
Yep.
it's going to make your mouth dry and your eyes dry, but now your eyes aren't running. So,
Yeah. Yeah. So now again, it boils down to asking the right questions, getting to the root cause of what the patient is experiencing so that we know the
right,
best treatment option for them.
right. Where
So,
do they
yeah,
work? What's their environment, their
exactly.
lifestyle? Yeah.
Exactly. So one of the things too, because I can't believe, but we're already running out of time.
I
I say
can't
this
either.
every episode. I literally say it every episode. I'm like, where does when you're waiting for your water to boil for dinner or whatever, and those 5 minutes take forever, and then all of a sudden these 30 and they're just gone. So yeah, it always blows my mind. So I just want to reiterate too, what are some of those things we can talk about and educate patients on from the environmental side? Obviously, decreased screen time,
Yep.
Wearing glasses instead of contact lenses. Like, what are some
Actually,
of the other things?
I'll just interject on that decreased
Yeah,
screen time. I did want to mention the 20-20-20 rule. Have you heard of that?
no, please share.
Every 20 minutes of screen time, you should look away from your screen for 20 seconds and focus on something 20 feet away.
Wow. Okay.
And
Interesting.
that helps you, because you're staring at a screen, you have an incomplete blink rate. So you're not, when you blink, you're lubricating your eye. So if you're
Right.
staring at a screen, you blink less and you blink incompletely. So this 20-minute, 20,
Mm.
20, 20, if you want to advise patients just to try that 20-20-20 rule, and I have to do it myself. I'm on a screen all the time.
Yeah. So again, it was, if you're staring at a screen for 20 minutes, look away every 20 minutes for 20 seconds and focus on something 20 feet away.
Yes. Yep.
Okay. Interesting. I like that. I'm definitely gonna do that. And I'm gonna turn to my left and look out of my window, and I'm gonna find something in
Right.
the
Something
snowy
fun to look
field,
at.
and I'm gonna look at it. Yeah.
I
Okay,
mean,
that's great.
don't do it every 20 minutes. Try to do it regularly. I mean, 20 minutes sounds like, 3 times in an hour sounds like a lot. But
It's a lot. I know. It seems a little daunting, but I'm definitely gonna do it at least ever so often when I
right,
think of
right.
it.
You
For
have
sure.
to get
Yeah.
up and walk every hour. When your watch buzzes you to get up and walk every hour,
This is true. This
look at
is
something
true.
else. So
So do it something different. Yep, that's a great time to do it. Yeah, that's great. Well, is there anything that you feel like we didn't cover, or any tips or tricks that we didn't give our pharmacist listeners out there that we wanted to talk about?
I don't think so. I think, having that stable of 3 or 4 products, giving them
Hmm.
some lifestyle, quick lifestyle stuff like that 20-20-20, wearing sunglasses, humidifier, and coaching perseverance and patience in the treatment,
Yeah,
and letting them know it's
setting
a
the
process. I
expectations,
think those are the biggest things.
take
Yeah.
homes. Yeah, that's great. That's great. Well, I think that kind of segues into my typical wrapping it back up and asking the guests what the game changer is. So if you could summarize, what's the game changer that we talked about today, what would you say it is?
I think the game changer is having a plan. Getting
Mm,
a little, it's hard because no one has any time, but
sure.
having that plan that I just talked about, those couple of products
Yeah,
you go to, training your staff, the rest of your team to be aware of all this. I think that helps
completely.
us. And I think we can really help patients through education and
I agree.
treatment. Yeah.
Yeah, and I think I love the idea also of sharing, like other things, like wear your contact lenses less, do the 20-20-20, like other things that they can modify, as opposed to just, squirt this in your eyes 4 times a day and, whatever. So I love the idea of making it a complete package and
Yeah.
really
As
kind
a
of educating.
pharmacist, I'm a less is better in terms of meds. So I
Absolutely.
really
Yeah,
like these different, hacks,
I
lifestyle.
love it.
And they're not big ones. It's not a big change, You're not
Exactly.
want to give up meat or, things like that.
Or go lose 20 pounds and then come back later and tell me,
Exercise
yeah.
an hour every day.
Exactly.
Right.
Exactly. Yeah, no, this is great. So good. Well, Jen, thank you so much. This was very informational, very informative. It was great. So I really appreciate your time today. Thank you.
Thank you. I appreciate it. Yeah. It was fun to be
Yeah,
here.
thank you. If you're a CE Plan subscriber, be sure to claim your CE credit for this episode of Game Changers by logging in at ceimpact.com. And as always, have a great week and keep learning. I can't wait to dig into another game-changing topic with you all next week.